Airlifting patients in need of emergency help has been a luxury undertaking, available only to those who can afford the high costs that comes with it. Emergency airlifting can cost up to over $100,000 per person. This is because such services are offered primarily by private companies who mostly cater for well-off individuals, to the exclusion of the majority who cannot afford these services. This will soon be something of the past as the ministry opens a new chapter in its fight to reduce maternal and child mortality.
We negotiated with the Ministry of Defense and the Ministry of Work and Transport to avail their helicopters, that is now the Defense Ministry, and the Ministry of Work to avail their Learjets.
The main causing concern is fuel, which the project is expected to save by about 70% compared to what is currently spent on commercial services. The aircraft will operate the Katima-Rundu route, Tsunkwe-Ogam to Grootfontein, Lodrats to Keetmanshoop, and hard-to-reach places like Kapur to Onuva, which can only be accessed by helicopter. These areas were chosen merely because of the distance critically ill patients have to travel on the road for medical attention, where sometimes patients lose their lives on the way to Windhoek. Parties involved in the exercise are currently working on a memorandum on how to proceed further before the project is implemented around June. Dr. Shanank Mackenzie, an obstetrician and gynecologist who has seen the suffering of mothers mostly from rural areas, said airlifting of emergencies will significantly prevent avoidable deaths.
But it is always cost effective to save lives of these young people. Because for every baby that dies unnecessarily, some babies sadly will die, but for a baby that dies, it's an avoidable death that costs society.
But then you put that little baby in an incubator on the road for 15 hours to reach Windhoek to try and be saved. And to ventilate a baby, you can imagine, on an ambulance for 15 hours is virtually impossible.
The bigger plan of the ministry is to put up regional call centers for emergencies, but another challenge is shortage of specialists. The state has a severe shortage of obstetricians and gynecologists, with only 10 serving the whole country. The ideal number is 50, and the Ministry of Health is building up to train more specialists. I'm Hangumbi, NBC News, Windhoek.